Diabetes in India is a growing health problem with more than half of the population at risk of developing the condition at any given time in their lives. Diabetes is a widely diffused chronic condition that impacts several aspects of patients' lives. If you do not manage this condition well, you can develop several complications. Many religions practice fasting for spiritual reasons, but it can cause serious health problems for people with diabetes. The change that occur in the body during fasting depends on the length of the continuous fast. It can affect your body badly if you don't take proper care while doing it. A combination of lifestyle modification, regular exercise and adhering to prescribed medication is essential to manage diabetes. To understand how to effectively manage diabetes, we have with us today a panel of experts. We have Dr. Atul Kulshrestha, consultant physician and diabetologist from Agra, Dayalbagh, and also we have Dr. Chordia, consultant endocrinologist, diabetes, thyroid and hormone specialist from Fortis JK Hospital in Udaipur. Also Dr. P. Krishna Prasanthi, senior consultant physician, Harshita Hospital in Tirupati. Thank you so much for joining us on the broadcast today. To begin with, my first question goes out to Dr. Prasanthi. Diabetes shows up in different people in different forms. What are the various types of diabetes and which type of diabetes is more common in India? Doctor.
Yeah, good afternoon everybody. In our country, we are seeing regularly type 1 diabetes, type 2 diabetes and other specific type of diabetes like gestational diabetes and other secondary causes of diabetes. Normally what we say is type 1 diabetes is the diabetes which we see in children and the young adults. Type 2 diabetes is commonly what we are seeing in the elderly group. That is a very common thing. Almost in our regular practice we see around 85 to 90% of cases are type 2 diabetes. There is the other condition is called gestational diabetes mellitus, where if a woman who is having or becoming pregnant, if she is detected to be a diabetic after 20 weeks of pregnancy, we call gestational diabetes. But after COVID, we are seeing that hyperglycemia in pregnancy. By the time she is becoming pregnant or first month or second month, if you are detecting diabetes in women, you call it as a hyperglycemia in pregnancy. The other common thing what we are worried after the COVID is post-infection diabetes, post-drug-induced diabetes, like what we are using indiscriminate of steroids for the various rheumatological conditions, dermatological conditions, even sometimes the viral infections also that trigger diabetes. In our country, we see most of the time the type 2 diabetes. Other than this, we see the latest varieties of the diabetes like LADA and the monogenetic varieties like the MODI also.
Right. It is said that obesity is one of the precursors of diabetes. When does one start getting worried about excess weight gain? And what are the other factors that can be a reason for diabetes in a person? Dr. Atul Kulshrestha.
Yeah. Thank you. This is a very interesting topic because all over the world we are facing the twin epidemic of diabetes and obesity, that is known as diabesity. As far as the risk factors for diabetes is concerned, the obesity is one of the most important risk factors that can lead to development of type 2 diabetes. Beside obesity, the other risk factors for the development of diabetes can be family history of type 2 diabetes, sedentary lifestyle, overeating or eating high calorie junk foods, the overstress. The stress of the life, they can also lead and precipitate diabetes. And beside this, as Dr. Prasanthi has mentioned, GDM, if a patient is having history of gestational diabetes, then these patients are more prone to develop diabetes. Now, the another thing is, if a diabetic patient, they are having obesity, then the chances of developing liver disease, kidney disease, heart disease, stroke, and vascular diseases, they are more common as compared to non-diabetic, non-obese diabetic patients. If you consider the effect of decreasing the weight in diabetes management, the researches has shown that just by decreasing 10 to 15% of the weight, you can decrease the blood glucose HbA1c by the tune of 1%, which in long term can reflect with the statistical or very important or significant reduction in the long-term complications of diabetes like kidney, liver and heart disease. So this is the importance of obesity in the diabetes.
Now, are all types of diabetes genetic, and does a family history of diabetes play a major role in new cases of diabetes? Dr. Chordia.
Yes, because when we label the segregation of diabetes, type 1 diabetes is a sporadic disorder, which is basically insulin dependent diabetes, which generally happen in children. But now type 1 diabetes also present in adults also. There is a variant of it which is known as LADA. It also presents in later age. It is more of a mild form of type 1 diabetes. For type 2 diabetes, family history is very strong because type 2 diabetes is generally running in family. So a very important change what we have seen today is that the adolescent boys or girls who are becoming obese are catching diabetes, and we are confused that whether it is type 1 insulin dependent or non-insulin dependent. So when you see the family history, in family if the diabetes is running, it appears more that younger kids are now getting type 2 diabetes because of obesity. When we talk about the genetic forms of obesity, definitely MODY, the maturity onset diabetes of lung, it runs in family. For that diagnosis, you need a negativity of antibodies. You need a 3 generations successively suffering from diabetes. So there are certain genetic syndromes also associated with diabetes, but predominantly what commonly we see is type 2 diabetes. And the alarming thing about type 2 diabetes is that in younger population, it is coming more commonly. And now the age is no segregation. A young can have type 2, an older one can have type 1. So it's clinical, but definitely it should be avoided. And this obesity itself, what my previous speaker was telling about, this should be reduced. If you reduce your 7 to 10% of weight, definitely you can prevent this in specifically adolescent boys or girls. Thank you.
Now, extra weight around your waist means fat can build up around your organs like your liver and your pancreas. This visceral weight is a major risk factor for diabetes. Do various diets or fasting help to lose this particular fat? Dr. Prasanthi.
Yeah, true. Because now we are seeing what the previous speakers were telling about the diabetes and obesity. There is accumulation of fat around the waist, and sometimes you have 2 different types of the obesity. Number 1 is the apple-shaped obesity, where you have the uniform obesity, where the excess fat is getting accumulated over the arms and the buttocks. The other is the pear-shaped obesity, where we commonly see in the Asian Indians, a lean type of the obesity. They may be having normal BMI, but they have the visceral obesity. The abdominal belly will be having more fat. So this kind of obesity is more dangerous because it is having the highest risk of atherosclerotic cardiovascular disease. So this kind of excess fat will be accumulated around the liver, around the pancreas, sometimes even around the heart, even within the blood vessels which are supplying to the heart, brain and kidney also. So once you start losing weight, either by your fasting or your medical nutrition therapy or your physical exercise, definitely the percentage of fat accumulation around these organs will be decreasing. The risk for atherosclerotic cardiovascular disease is coming down, and your metabolic profile will be absolutely normal as it progressively increases. Once you increase your lifestyle modification, the increase in incidence of decreasing the complications which will be observing regularly.
Right. Now, Hindus observe fasting during Navratras and the Shravan months, while Muslims fast during the month of Ramadan from sunrise to sunset. Is it advisable for them to seek a doctor counseling before fasting, especially when they're on diabetes medication? Dr. Atul Kulshrestha, if you could answer that.
And this is a very important question because nowadays our Muslim brothers, they are having Ramadan fast. And recently, the Hindu brothers have already undergone this Navratri fast. So prolonged and intermittent fast, they are very important. And especially for diabetic patient, it is advisable to contact your doctor before starting the fast, because our aim during the fast first aim is not to prevent the low blood sugar, that is known as hypoglycemia. That should be the first aim. Second aim should be to decrease the excursion of the glucose after breaking the fast. So in order to keep blood glucose near normal range, it is advisable to contact your doctor and try to adjust the dose. Presently, we are having lots of newer drugs for management of type 2 diabetes, and the beauty of newer drugs are they are having action depending upon the blood glucose levels. If the glucose level is high, their action will be more. If the blood glucose is low, then their action will be reduced. So try to contact doctor, try to adjust the dose. For weekly fast, which most of our Indian Hindu families they are doing, in weekly fast it is advisable to omit the morning dose of the hypoglycemic agent which they are taking, but continue the evening dose of the evening dose of the drugs they are taking regularly for intermittent, like weekly once a day fast during the week. So these are certain important points on which this is the management of type 2 diabetes is dependent during the days of the fast. So try to contact your doctor beginning the fast.
Right. So type 1, type 2 and gestational diabetes management is different. Is fasting safe for all types of patients of diabetes? Dr. J. Chordia.
Yes, a very, very important question, because you can't apply the rule of fasting to everyone. When we talk about type 1 diabetes is insulin dependent diabetes, where a kid may need 4 times insulin prick with breakfast, lunch, dinner and bedtime. So it's very difficult on a basal bolus treatment to maintain type 1 diabetes, because type 1 diabetes kid may be 6 years, 7 years. So we don't generally prefer fasting in type 1 diabetes, except for scenarios where the type 1 diabetes has become adult and he is well controlled. He may be on, say, subcut insulin infusion pumps or latest of technologies, or he may have a continuous glucose monitoring sensor, where partially we can say, okay, for a while or so, because religion is also important, you can go for that. Pertaining to type 2 diabetes, definitely this is a holy month of Ramadan, where we are Jain, many population of Hindu population also do fast, and they don't comply on that part that no, we will not do the fasting. They all say that we will do the fasting. So as a medical endocrinologist, my role is that basically first and the foremost, for a type 2 diabetic, your glycemic control should be good for fasting. Your body profile should not show any negative side effect. No comorbidity should be there. Your diet pattern should be at least fixed, so that as my previous speaker told, you can just adjust few of the doses or omit the doses, and you can acclimatize the fast with diabetes management. Pertaining to gestation diabetes, because it's a pregnancy-induced diabetes, generally it is not so very high also, but pregnancy is a condition of accelerated starvation and fasting. So I would prefer that pregnant female should not fast until proved otherwise. For an occasional on a diet and lifestyle modification gestation diabetic, we can go for fasting, but otherwise we don't recommend. So on a broad front, type 2 diabetes can, if they are well controlled. So ultimately the glycemic control is important. For type 1, I would say majority of the time I would say no. And for gestation diabetes, it depends upon the scenario of the patient. Thank you.
Right. So on this note, we're taking a very short break, but we'll be back with a whole lot more on the other side of our show. Beat Diabetes, Myths and Facts. Stay with us. Welcome back. You're watching our show Beat Diabetes, Myths versus Facts. Let's take the next question to Dr. Prasanthi. What role does exercise play in managing diabetes? Is it safe to exercise while one is fasting? What are some of the points to be careful about while exercising with diabetes? Doctor.
This is a very important question, because in the post-COVID pandemic, everybody wants to do exercise, and everybody will be asking one question: what is the best exercise for a diabetic patient? Normally, we say the regular walking is a very comfortable exercise which you can do for 150 minutes per week. So normally we say half an hour a day is a good thing for you, but depending on your cardiac condition, depending on your physical fitness, depending on your bones and joints, you can do up to 1 hour also. But there are some people who can go for jogging, swimming, running, and those who are young diabetics, they can go for a regular gym. That is a very comfortable thing for us. But what are the precautions to be taken during fasting is, if the patient is on fasting and definitely they are not taking any food, I think ideally it's better not to go for a vigorous exercise or a gym. That is a very dangerous thing. Because patient may be already at a risk of hypoglycemia, patient is already at a risk of a dehydration because they may not be taking any fluids, and if they are going for a very long walk or a vigorous exercise, then definitely patient may be going for a state of an unconsciousness. But a long-standing diabetic who is having a retinopathy, that means if the patient is having any visual disturbances or a vision problems, or if the patient is having a long-standing nephropathy where patient is having a difficulty in the appreciation of the sensations, or if the patient is having a long-standing diabetic kidney disease, those on dialysis, they should not go for a rigorous exercise, and they have to go for a definitely pre-exercise counseling is needed. Nowadays we are seeing the young diabetics between 20 to 30 years, they are going for gym. I request all the obese diabetics, all the diabetics who are having very high blood sugars, all newly detected diabetes with a high blood sugar, those who willing to go for a gym, definitely they should have a cardiac evaluation, a prior treadmill test, a prior 2D echo, a prior ECG is very, very important, because these days we are seeing that the patients are a diabetic persons are suddenly collapsing in the gym. So a regular physical activity, half an hour a day, is a very good thing. All long-standing diabetics should take a necessary pre-exercise counseling. Any newly detected young diabetic, before going for a gym, try to have a cardiac evaluation.
Right, very informative there. Now, how frequently should a patient monitor blood sugar while fasting? Do continuous glucose monitoring system help in these situations? Dr. Atul Kulshrestha.
Yes, this is a very important thing. Actually, our aim during the fast for the diabetic patient is to keep blood glucose near normal and to check the hypoglycemia, that is low sugars. And for that, frequent checkups they are very important during the time of the fast. So ideally we advise to measure the blood glucose by the simple glucometer at the beginning of the fast and at the end of the fast daily. And if a patient is having any symptoms suggestive of low sugar, then we advise them to check the blood glucose at that point of time. So that is a very important thing. Nowadays, we are having a very important device that is known as continuous glucose monitoring device. With this device, we apply a patch on the either forearm or on the abdominal wall, and this patch stays for 14 days, and with this every 15 minutes there is a measurement of the blood glucose, and you can scan by the help of the scanner put on the surface of this patch, and you can detect the blood glucose levels at that particular time very well without doing an extra prick. So these data can be applicable for 14 days. We can detect and we can download. We can also connect it with our smartphone. So these modern devices, they are very, very helpful, especially for the management of type 2 diabetes, especially for the measurement of the blood glucose without giving an extra prick. So frequent managements are very, very important part as a treatment, and especially during the periods of the prolonged fast.
Right. So what are some of the complications associated with long-term uncontrolled diabetes? What preventive checks can be done in order to detect the complications early on? Dr. Chordia.
So diabetes, once it is labeled as diabetes, it's a disease of complication. It is not a single disease, because the biggest myth on a public platform, what we can inform is that we consider diabetes as a disease of sugar. That means you measure your sugar and that's all. If sugar is controlled, your diabetes is controlled. That is not all. So for a diabetic patient, specifically for a new onset diabetic patient, it is recommended that you get a basic screening, which includes your eye checkup. That is a fundus, because the diabetes damages your retina. Urine checkup, which shows basically whether your kidney is having an incipient damage or not. Pertaining to your cardiovascular system, what my previous speaker told about the exercises test, and that has to be done. Then pertaining to your atherosclerotic burden. So there is a profile. Basically, once in a year, a diabetic patient should undergo a basic profile pertaining to all of these parameters. What we see, a patient visits you 1 year, 2 year down the lane, and he just shows you sugar values and that these are my sugar, and so don't get anything else. So we need a dedicated laboratory, a dedicated investigation profile to judge that whether the complications are there. So when we talk about diabetes, it's a disease of complication, it's a disease of comorbidity, it's a disease of mortality. The major cause of death, whether it is cardiovascular, whether it is end-stage renal disease, whether it is atherosclerotic burden leading to stroke, the major cause is diabetes. So kindly control your diabetes for the prevention It's always better get your glycemic control, go for regular checkup for your to your doctor. Keep yourself, your tongue under control, your diet, exercise, and medication should be very much compliant. And if you keep this, I think that you can escalate another 10 years of that, of your life. So the very important thing is right from the beginning, once you are labeled as diabetic, don't curse yourself that you are a diabetic. Just take care of your diabetes as a challenge. Keep it under control so that you are prevented from the complications of diabetes.
Right. What precautions can one take with diabetes in order to avoid hypoglycemia? Dr. Prasanthi, if you could take that question.
Yeah, this is a very important thing because every diabetic, at least once or twice in his duration of the treatment of the diabetes, might have been experienced this hypoglycemia. What do you mean by hypoglycemia? Means if you have the low blood sugar at that value, patient may be having the experience of symptoms like sweating, like feeling like anger or worrying or worrisome, some palpitations, like some profuse sweatings. He feels like that he is about to fall, he is going to have a loss of consciousness. So any kind of symptom can occur and these symptoms will be labeled as a hypoglycemia. Many of the patients will be asking at what blood sugar we may having the hypoglycemia. Is it the number alone? No. Normally we say it is the less than the normal, around 60 to 80 the patient may be having the all these symptoms. But a long-standing diabetic who is having the high blood sugars of 300, 400, even at 150, 200 also he might have experienced the all kinds of symptoms. So what we have to understand is any patient experiences this kind of symptoms, first you have to think whether you have skipped your meal or whether you have taken the insulin or tablet and not taken the food, or whether you have taken the more amount of drug like insulin and less amount of the food, or you have taken the medication and went for walking. All these things are the precipitating factors. So very important thing is in a diabetic patient, the regularity is very, very important and timing of the meal is very important. Timing of the drug is very important. As far as possible, we want to avoid the hypoglycemia. But in a long-standing diabetic of 30 to 40 years, we have an autonomic neuropathy, a glycemic variability do occur. In a young type 1 diabetic, a newly detected diabetic, who are unable to understand what exactly is happening in the body, the titration of the insulin, they may experience this hypoglycemia. But those patients who are a regular on travel, on tour, we wish them to carry a card that they should write that I am a diabetic, I am on this medication. If the patient is having a risk of hypoglycemia like a kidney patient, dialysis patient, or the patient is on some other medication, definitely you should have a risk of the hypoglycemia card and you should carry either a piece of a chocolate or now some hypo tabs are also available. So I request that any patient who is a diabetic, better have a note of your medication so that some undue event is going to happen. The treating doctor or neighboring person can take care of you, and we should see that the hypoglycemic patient should not be ending into a stage of a coma.
Right. Thank you so much, Dr. Prasanthi, as well as Dr. Chordia and Dr. Kulshrestha for joining us on the broadcast today. With that, we're slipping into a very short break. News and updates will continue on the other side.